Hello, welcome to our show. My name is Dr. Fred D. Smith, Jr. I am professor of public theology at Houston Graduate School of Theology here in this great city of Houston. And our guest today is?
Archie Sutton.
Who are you, Archie?
Well, I'm a local pastor here in Houston, and I'm just very interested in hearing what you have to say today.
Well, today we're going to pick up where we left off last time. But I want to do just a little review. The Texas Faith and Health Summit, the beloved community of health. And you'll see that information at the bottom of the screen. But what is it all about? It's about a dream. And this is the dream. The dream is it not impossible to dream of thousands of congregations that see health as a seamless whole, physical, mental, social, and spiritual, that see poverty and illiteracy and addiction and prejudice and pollution and violence and hopelessness and fatalism and conflict as brokenness, disease, that require the redemptive force offered by the faith community. That's what it's about. And what this show is about lifting up those faith communities that meet this dream. We call this show The Bright Spots. This dream first came to me when I was worked at the Carter Center from 1989 or 1990 to 2000, really. And our director at that time was a famous guy. His name was Dr. Bill Foege. He was an epidemiologist who worked in a successful campaign to eradicate smallpox in the 70s. Dr. Foege became chief of the smallpox eradication program at the Center for Disease Control and Prevention and was appointed director in 1977 under President Carter. After President Carter left the White House and formed the Carter Center, he made Bill Foege the president of the Carter Center, and we created what's called the Interfaith Health Program. And much of you're going to be seeing really comes out of that work. We started at that time, we were talking about a faith in health movement. And that faith in health movement was more than just about hospitals or about health ministries, about blood pressure. It was about justice. It was about how to help people to eliminate what we call that time health disparities. And so the goal of the Texas Faith and Health Summit is to bring awareness of the potential and the actual role of faith communities in transforming our failed healthcare system. We spend more money in the United States on healthcare than any other industrialized country in the world and get the worst outcomes. In fact, some of our outcomes are worse than many third world countries. And if you don't believe me, look it up. And so what we want to do, and we believe that since the faith community had an important role of shaping the healthcare industry, way back in Egypt in the temples, yes, or the hospitals at the Catholic churches and the Catholic cathedrals in the great cities of Europe, or the pioneers of the Methodists and the Baptists and the Lutherans who created hospitals that dot this entire nation.
Right.
We create the health systems, and we're going to be the ones to transform it. That's my belief. Thus said the prophet. In fact, we want to create a health system without walls and without barriers to good health with anybody. Can you imagine that? No walls, no big buildings, no insurance policy, no things that keeps you from a barrier from having good health. That's our goal. And to do that, we want to deepen collaboration between health systems, public health, and congregations, our faith-based organizations. We want to develop what's called a peer learning action network. And what that is, the plan. What plan? God's plan.
Right.
Okay, and so in Texas, these peer learning action network will provide technical assistance to other people who are trying to do the same kinds of things. And we want to deepen collaborative action on a local and a regional level. And we want to really start a conversation about faith and health collaboration and what is called population health, which just basically means where you live, people where you live, in your community, on your block or your school. That's a population, okay? And health equity has to do that everybody in that population ought to have as much access to health care and livable communities and opportunities as everyone else. And to do that, we want to have bright spots. That is, bring awareness to the actual and potential roles of faith communities to address population health and health equity, and to expand the knowledge and deepen the collaboration between hospitals, public health, and faith communities to create livable, healthy communities. And so these bright spots are promising practices in faith and health ministries that address what's called the social determinants of health, basically, and to address these social inequities. And as we mentioned the last time, these inequities are based on the immoral vision of racism, what we call white supremacy. And we've seen some of that, on TV just recently in our last political environment. We want to replace that vision with another moral vision that requires leadership of people to work outside the boundaries of institutional powers and work between the boundaries where people live and where people are and where things happen. And by that, we want to create health parities, not disparities. And this only can be achieved by a new vision, a moral vision, the vision of the beloved community.
My.
This is social determinants of health. This is a graph that shows what the social determinants of health are. It begins in the middle there with our age, our sex, our factors. That's about, the individual lifestyles, that's maybe about 10%, what causes health, our health, our individual factors. But around there, then our community social networks, that's the yellow band. That's our neighborhood. That's where you got parks in your neighborhood, whether you have schools, whether you have community groups, like stop crime groups or those kinds of things, just social networks. And around that are the living conditions and work conditions. That includes agriculture and food production, education, the work environment, unemployment, water sanitation, access to health care and housing, those things. And around that, the general. But let me go a little bit further. Now, I'm going to see if we can't. Y'all forgive me for a minute, because I need to do a little technical stuff here, because I'd like to show you a video, if you don't mind. This video explains what we've been talking about.
What determines how long we'll live? Is it what we do? Is it who we are? Actually, when it comes to predicting how long you'll live, your zip code is more important than your genetic code. Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A-Town, while Maria lives in B-Ville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of B-Ville will die more than 15 years sooner than the residents of A-Town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, B-Ville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are B-Ville's many liquor stores, fast food places, or convenience stores. The schools in B-Ville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, for all the residents of Beeville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Beeville get so different? Well, in many cases in cities and towns across California, the root cause was racial and economic discrimination. Over the generations, poor white people and people of color were pushed to less desirable parts of town. Where banks refused to lend money, businesses left, jobs too. Schools declined, and the neighborhood crumbled. Everyone who could move away did. And what's more, when communities like A-Town and Beeville are so unequal, Beeville isn't the only one that suffers. Because it turns out that not only is your zip code a predictor of how long you'll live, so is what country you live in. Countries with the greatest income inequality have the lowest life expectancy. So even Americans like Deb, who are white, insured, college-educated, and upper income, die younger than their peers in other countries. In fact, our life expectancy is 43rd in the world, and that number is slipping. In the end, our biggest health risk may actually be inequality, and extreme inequality hurts us
sorry.
all. So what do we do? Well, if we're all going to be healthier, we don't just need to help the folks in Beeville beat the odds. We need to change the odds for everyone.
Sorry about that. I'm technically handicapped.
And that's what we're doing. There's a movement happening. We're Californians.
I ended there because we're Texans. This is a film that was produced by the California Hospital Association, who are beginning to address the issues that we want to address here in Texas. And that's what the conference is about, is to bring this kind of thinking and this kind of work to Texas. All right? So, what are we trying to do to go from health disparities to health parities? First of all, we gotta stop thinking about what causes us to die and start thinking about what causes us to live. And you know, some of those things, what are those things? Hope, faith, purpose in life, our connections in our relationships,
Yes.
blessings, prayer, you know, all those things help to create life in the cause life. Because if you have those things, and we need to go away from what the community needs to what community assets are. In every community, even those communities that Maria lived in, there are assets, but they're undercover. You know, nobody knows about them or nobody appreciates them because they don't look like the assets in another community.
Yes.
But they're there nonetheless. So we need to find those assets and to activate them and to make it, and what better place to do that than the church? Huh?
That's right.
Huh? And so we need to go from racism or an immoral vision of white supremacy to the beloved community, where everybody, regardless of their race, their creed, their color, their sexual orientation, are loved and assured they're loved. And that's the way we go from disparities, health disparities, to parities. So, in population health, all these things are important. Health disparities, I'm using these words and we're going to define them as we go along. Health disparities we talked about is making things when it's unequal, when access is unequal, when opportunities are unequal. Those are disparities that leads to bad health. Social determinants of health, again, those are the social things like education and where you work and where you live and your housing. Those are called social determinants of health. And of course, you know, access to health care, chronic disease management, that's what's caused by these disparities. You know, and illnesses and the criminal justice system, affordable housing, all those things are things that we need to address. Now, some of the things that churches do and can have, some called navigators, and we'll explain this on another show. Community health workers. Health workers with life experience, that means a drug person who come through drug addiction, help other folks who are in drug addiction. Those who have diabetes and been through diabetes, help other people with diabetes. That's called life experience community health work. Parish nurses are community nurses. Many people know about them. Health clinics, many churches have that. Health fairs, urban farms, urban markets, feeding programs, support groups, social services, low-income housing. These are all some of the ways that are bright spots that we want to lift up on this show, because churches are doing all of these things. Now, one bright spot that I want to tell us about today is called the Alameda County Care Alliance. The Alameda County Care Alliance is in the Bay Area, the place where we talked about earlier, where the study was done. And they have a vision. All those living in Alameda County with advanced illness will receive person and family-centered care that acknowledges the spiritual and cultural integrity regardless of what race, religion, orient, and creed, the beloved community. The mission is to build community-based resources, assets, health system partnerships, hospitals, public health, to provide a paradigm of health care through care coordination, spiritual care, decision-making, and support for ill persons and their family. That's a vision of this Alameda County Care Alliance. Now, how is this made up? Well, it's a dynamic collaborative partnership with faith-based community organizations that have a long history of working together. These communities really started off with 5 large churches. One of them is Allen Temple, who will be at our conference. J. Alfred Smith, who's one of the creators of this, will be at our health summit. But it represents over 35,000 people. As you see, it was just launched in 2013. The partners, here's some of the partners: the Kaiser Permanente Community Foundation, the California Healthcare Foundation, the San Francisco Foundation, the School of Nursing at UC Davis, the Public Health Institute, UC Berkeley, CTAC, just on and on and on. We have, this is in Oakland, and here in Houston, Texas, we have the medical center. We have 2 great public health departments. We have all kinds of foundations and people who care. What if we all came together, and formed an alliance to improve the health and to eliminate disparities?
That's what this health summit
And that's
is
what
about.
the summit is all about. That's what I mean, those objectives, this is our objective. Here's some of the things they're doing. This is their advanced care readiness program, helping people with healthcare needs. And what you have, they talk about pastors, faith leaders, navigators. Navigators are those who help you. It's just like you're a ship navigator or airplane navigator. They help show the path, show you how to get one place to the next. In this case, they help you navigate the healthcare system. They help you navigate the community so you know where the resources are.
Right.
Okay? Pastoral support. That makes some difference. The pastors are actively involved. In our conference, we're going to have a pastors roundtable. Fifi Cofield, Manson Johnson, Rudy Rasmussen, and many other the faith leaders in this city is going to come together at a roundtable to begin to talk about what we can do to improve the health of our community. And of course, caring for those who care for others, caregiver support. As you can see, these are the 5 major churches. Allen Temple Baptist Church, Glad Tidings, this is a Church of God in Christ where the bishop resides. The Family Bible Church, the independent church, the Center for Hope in St. John's, which is a Baptist church. Right now they have many more churches. This was just a few years ago. Now they have dozen churches scattered throughout the area that are called hub churches. Hub is where it's like the center, and it has spokes that goes out. Many of our major churches here in this city, they're not just the one church. Some of them have branches, and they have other churches that work with them, and they're part of a hub. So what if we hook these hubs up together around the city? Then there's also in San Bernardino, California, something called the Faith Advisory Council for Community Transformation. It's led by a guy by the name of George Lamb. George Lamb will be at our conference, okay? And he's coming to talk about his agency that serves as a coordinating agency for developing collaboration and partnerships between local government, community, and faith-based organizations. It provides access to resource development, technical assistance for faith-based organizations, provides service for vulnerable populations. It deploys educational toolkit, trains leaders, and support partners with government. And they have a new project that they're going to tell you about where they're building homes for foster children that have been aged out of foster care. I think that's right. Well, Lamb will tell you about it in the mental health facilities and so forth. But he'll tell you more about it. When you come to the summit, you'll hear about that. These are some of the things that they try to do. Transform communities to alignment of, again, when we talked about social determinants of health, education and development, economic development, education development, health and wellness, housing, public policy, and public safety. Those are the social determinants of health. And this alliance, working with government, working with the community, works in these areas. Some of their partners, this is where they work at San Bernardino, the Inland Empire. They work with the Loma Linda Medical Center as one of their major partners. Another one in Maryland. I can't go through all these, but again, they work with stakeholders to build faith community health network, modeled after the success of the Memphis model. And the Memphis model would be here. There have some of 640 churches that are partnered with hospital systems in Memphis, working in communities, what they call transitional care. When you leave the hospital, you go to a place where you transition to make sure you don't go back to the hospital again, because you got folks in the faith community that's taking care of you. They're working with, that's in Memphis, Tennessee. They're working with the Life Bridge. We hope these folks will be there as well as one of the bright spots. The congregational network I just talked about was Methodist of Bonner Hospital System. It has more than 640 hospitals now in covenant relationships, a relationship with healthcare, and they do adaptation workshops to teach other communities around the country how to do the same thing. And this is where I worked at one time. It's called the Center for Excellence in Faith and Health. That was a direct descendant out of the Carter Center and Bill Foege, talking about thousands of congregations. It's possible. We want 1,000 congregations in Texas, networked together, to change the lives of people. It can be done. It is being done. And that's what the Bright Spots is all about. It's a dream of Martin Luther King. That it's a dream of 1,000 churches working together. Why? To create equal opportunity of privilege and prosperity, a property widely distributed. A dream of a land where persons will not take the necessities from the many to give luxuries to the few. A dream of a land where persons do not argue over the color of a person's skin to determine the content of one's character. A dream of a place where all our gifts and resources are not held for ourselves alone, but as instrument of service for the rest of humanity. A dream of a country where everyone is respected for the dignity and the worth of all human personality, where humankind would dare to live together as brothers and sisters. And when this is filled, when the beloved community comes, we will emerge from this bleak and desolate midnight of man's inhumanity to man to a bright spot, to a bright and glowing daybreak of freedom and justice for all God's children. And again, this is based upon, as we talked about the last time, and I'm going to do a whole session just on the beloved community, on Josiah Royce, and all the different iterations of how this was called you use these big words. I'm a professor, I got to use big words. A utopian social metaphor. Okay? And that's what the beloved community is for movements, because it's a community where love and justice rule. Doesn't that sound like the reign of God?
Yes.
The reign of love,
Yes.
and the reign of just God? Where distinct individuals, me and you, born in different places, different parts of different mothers and fathers, maybe of different races, where we can live together, in love and share a common future, where all of our stories, rich or poor, white or black, whatever, when we come together, what we might have thought was the past is gone. We say we leave behind those things that's behind us, and we look forward to the future, pressing on towards the mark. Okay, and these are the 5 principles of beloved community. I'm going to close with these. And you remember, anytime you want to talk about, what is the beloved community and what does it mean? It's these 5 principles. It's where love and justice rule. If there's no love and justice, there's no beloved community. Where everyone's worth is affirmed, no matter what your background, how much money you got in your pocket, how pretty or how unpretty you are. I'm not saying you're not pretty. But you're still loved even if you weren't so pretty. Where our diversity enriches all our lives because we all share common memories. We are humans. We have same kind of memories, and we share a future together. Where our stories, no matter what they are, like I said, no trial even if you're tested, you have a testimony. So our stories inspire hope. And where we're all loved unconditionally and forever. What does this mean? Martin Luther King dreams of love and justice. Practically it means a community where this love is not by taking the necessities from the many to give luxury to the few. Where we share our resources. What does it mean? In practical terms, it means that persons do not argue over the color of one's skin to determine the content of their character. That's the dream of the beloved community. What does it mean? It means that our gifts and our resources are not held for ourselves, but as instruments, as tools. We're in stewardship of the gifts that God gives us. And he gives it to us, why? Not just to serve ourselves, but to serve the rest of humanity. The dream is practically means of sharing our stories. By sharing our stories one for another. That's what we're going to do in this show. We're going to be sharing stories one with another. Why? Because sharing our stories, we come to respect the dignity and the worth of all human personality. Because we heard your story. And humankind would dare to live together as brothers and sisters. Isn't that a wonderful dream?
Yes.
Isn't that a wonderful dream? Each individual is assured that they're loved. We're all loved unconditionally and forever. Equality of opportunity, of privilege, and prosperity. That's what the film said, opportunities, widely distributed. That would eliminate health disparities. How? By aligning the faith community and those health communities. Because really they're one thing. When it began, they were all one. In fact, you go to Africa, you can't find a word for faith and health because they won't know what you're talking about. Faith and health are one.
Yes.
And we're talking about trying to put them together again. It's a love story. And we want to crack history wide open. Okay, shalomalization. That's our term that I want you to learn now. Shalomalization. What does it mean? It means worldwide. It moves communities and worldwide systematically towards shalom in the beloved community. We have a break in history now. We can change history. We can create a new future where love and justice rules. A future where individual worth is affirmed. A future where diversity is what we seek. A future of a story of hope, of unconditional love. Why? Because we are the beloved community. And if you want to contact us, you want to hear more, if you want even a copy of these PowerPoints, give me a call or email me. I'd be glad to share this with you because we want the world to hear the story and to dream the dream of the beloved community. In Jesus' precious and holy name, I pray. Amen.
Amen.